Let's start. So how many of you feel that pedigree analysis is difficult to understand? And like, how many of you know what pedigree analysis is? Or is there anyone who don't know what pedigree analysis is? You can raise your hands. Okay, it's just a discussion. You don't know, it's fine for me. Okay, it doesn't matter you know it or no, doesn't know it, I'm going to teach you. So what is pedigree analysis? Someone? It's there written, huh? So basically, yeah, you have to just analyze what type of inheritance it is. Okay, so it's a tool in genetics, okay, to trace the inheritance of genetic traits and diseases, okay, within the families across. So it's no one is going to ask you the definition, but what is more important for you to understand here is the symbols used. So you can see there a rectangle, okay, which is uncolored rectangle. It's used for normal males, and you have the genetics or the chromosomal arrangement as XY. Okay, then you have got the females, that is round, which is uncolored. I've just shaded it yellow. Don't consider it as colored. Okay, and it's females, and it's the chromosome is written it as XX. So it's very important to understand these two things. XY is male and XX is female, means males have one X chromosomes, females have two X chromosomes. Now, what we're going to study here is if you have a dominant trait, as males have only one X chromosome, if something is dominant over this X chromosome, it's going to get manifested. Okay. Now, in case females, even if it's, when it is dominant, it's going to get manifested in females also, because it's dominating. Okay, the character is dominating. On the other hand, in males, even if it is a recessive one, so it's just I'm shading it blue. Even if it's a recessive one, it's going to manifest because only one X chromosome is there. Whereas if it's on females, as they have got two X chromosomes, it is recessive, then the other one is going to dominate. Okay, the deceased gene, the deceased chromosome or deceased trait is going to hide itself, and the non-deceased trait is going to get manifested. Okay, so this is one thing, we'll understand it better as we go on, but the key here is if it's an X-linked disorder, males are always affected. Females can be carriers. If it is an autosomal recessive disorder, females can be affected if it's a dominant disorder. Okay, so now when you come on to the next slide here, the same, rectangle, it's affected male if it is shaded any color, black, pink, whatever they give you. Okay, and the same thing, round, affected female. Okay, and if it's half shaded and rectangle, it is a carrier male. Okay, and if it's half rounded, it's a carrier female. Okay, that means this is heterozygous. Okay, these things are homozygous if it's fully shaded. Okay, now how to analyze a genetic disorder? If you can write it down, write this down. We're going to focus a good amount of time here. Okay, if my voice is getting unclear or anything like that, please stop me. Okay, now this is where we are going to discuss, and this is going to tell you what type of, these two charts we're going to discuss. Okay, two steps we're going to discuss, and this is going to give you a good understanding if it's an autosomal dominant or recessive disorder or X-linked dominant recessive disorder. But first thing which you have to do is you have to check if there is a mitochondrial inheritance or not. If anyone can tell me what mitochondrial inheritance is.
Sir, which is coming from the mitochondria of the mother.
Exactly. So in this case, I'm going to discuss this later on, but definitely what happens if you have got a father here and a mother here, the father doesn't transmit the disease to anyone. Okay, and the mother is going to transmit the disease to everyone. All her children, the disease is going to be transmitted. Here by father, it doesn't get transmitted to any of the children. So it's like all in this or none. Father doesn't transmit to anyone, mother transmits to all. Okay, so it's a very peculiar type of inheritance. The reason behind that is the sperm doesn't contain, or if at all it contains very little mitochondria. All the mitochondria of the child is coming from the mother. So any gene, if at all, is problematic in mitochondria, it's all going to come from mother. Sperm doesn't contain, or very little mitochondria it contains compared to the ovum. Okay, so that's the reason. So the first thing you're going to check it if it's mitochondrial inheritance. It's very easy. Okay, we'll discuss that later. But what really problematic for you all is if it's X-linked or autosomal. Okay, so then the next step, what you have to see is this order you have to follow. The next step is check if there is any sex predilection or not. I'll tell you how to check for sex predilection later on. But the second thing which you have to do is if there is sex predilection or not. Now, if there is a sex predilection, if it is present, okay, hope you're able to follow. I'm just shading instead of what happens usually is that gets appeared. Hope this shading method is easy for you, isn't it? You can follow this, all of you. A few response, 2-3 response. Are you able to follow this properly?
Yes, sir.
Yes, sir.
Everyone, right? Okay. Now, if there is a sex predilection is present, then there could be two possibilities. Is there both males and females affected? Or if only males are affected? There's two possibilities, isn't it? There's no possibility of only females being affected. There's no such possibility you will see. So there are only two possibilities here. If both males and females are affected, or only males are affected. If both males and females are affected, then you can say it as an X-linked dominant. Okay, we're talking about X-linked. Okay, because there is a sex predilection. So it's X-linked. And if both males and females are affected, then it's a dominant trait. How? How do you know that? Because I told you, the X chromosome, males definitely will be affected, whether it's dominant or recessive, because they have only one X. Females have two X, but now this is dominant. So even females will be affected. So in dominant, both males and females will be affected. Now, whereas if you see on the X-linked recessive part, you have only males being affected, females you will see it as a carriers. Now, there is some exceptions which you will see later on, but please note this down. Okay, or at least keep this in your mind, that if both males and females are affected, it's a dominant X-linked dominant. If only males are affected, there's X-linked recessive. Now, when it comes to autosomal, no such thing called a male-female, because there is no sex predilection. Okay, it's how many number of progenies, how many children. They're not going to tell you about males or females. Okay, if at all they tell you, they'll tell you that both males and females are affected equally. Okay, or there is no sex predilection kind of thing. Okay, now here, now you'll say that, okay, what about here? If both males and females are affected, then isn't it X-linked? So don't confuse yourself. You'll understand it better. But please note, in autosomal, there is no sex predilection. Okay. Now, if there is no sex predilection, that's what we're going to discuss next. Okay. Disease transmitted to only half of the offsprings, or 1/4, or even or less than half. Okay, if this is transmitted to half or more of the offsprings. Okay, you will see lots of exceptions to this, but yes, you will understand that also later on. But in general, if it's half or more, it's autosomal dominant. If it's less than half, that is 1/4, it's going to be autosomal recessive. Okay, now when it comes to autosomal, there is more conditions to be applied, which we are going to see next. Okay, so this all of you understood. Okay, just let me know. Only two things to know: is there sex predilection or not? If it is there, are both males and females are affected? If then, they have got X-linked dominant. If only males are affected and females are carriers, it is X-linked recessive. Now, when you come on to if there is no sex predilection, you have to just by heart this. Okay, even if you don't understand this, just by heart this. You'll understand it slowly by slowly. if there is no sex predilection, you have to see half or less than half. Okay, there is nothing called males and females there, isn't it? Now let's understand another small chart. Now don't see as such now. Okay, I'll explain this. So as you all know, there are two disorders, X-linked and autosomal, which can be dominant and recessive. That is what X-linked dominant, X-linked recessive, autosomal dominant, autosomal recessive. Now, X-linked means there is a sex predilection. Okay, and autosomal means there is no sex predilection. This is understandable. Okay, and what we said was in the previous slide, what did we say? We said that whether males and females are affected, so how many, whether males and females are affected or only males, and other thing which was we discussed about autosomal was half or 1/4. Here, one more thing I'm going to add. Okay, if it's a dominant trait, especially autosomal dominant, okay, that's why I told you here, you need more points to add here when it is autosomal. So if it's a dominant trait, especially autosomal dominant, also a little bit applicable to X-linked, but especially for autosomal, please note, just write it there, especially for autosomal, at least one parent will have the disease. Whereas recessive, the parent can be carriers. It is not necessary, or most of the time, parents will not have the disease. They'll be carriers most of the time. Okay, so that's one point, especially when it comes to autosomal. Sex-linked, it's very easy to understand here. Whether both males and females are affected or only males, it's easy. But when it comes to autosomal, you have to know one more point here, which we'll discuss questions later on. Is the parent affected or having the disease, then it is dominant, autosomal dominant. If the father is not, a father or mother, parent is not having the disease, okay, whether they are the carriers or not at all having the disease, it's going to be an autosomal recessive. Now, so I've told you, except for X-linked male, that's what I told you, it's very clearly applied to the X-linked trait. So in X-linked males, because I've told you only one X chromosome, isn't it? So there's no carrier state there. Okay, they have the disease. So even if it's a recessive disorder, X-linked recessive, father will be affected. Very understood this part. Any confusion? Is there any confusion? Ask me, because this concept has to be very, very, very clear.
Sir?
Yeah.
Can you repeat that recessive part once more?
Yeah, what I mean here is, see, you understood this, that is autosomal dominant, one parent will be affected. Autosomal recessive, parents can only be carriers. When it comes to X-linked dominant, again the same applies, at least one parent will be affected. Okay, X-linked dominant, the same concept. Okay, once again I'll tell you, if it's an autosomal dominant, one parent will be affected. Okay, now if it's an autosomal recessive, it is possible that no parents are affected, it can be carriers. Now when it comes to X-linked dominant, again the same thing applies, one parent will be affected. But when it comes to X-linked recessive, okay, what happens is, even if it's a recessive, what is normal in recessive? Parent can be a carrier, male can be a carrier in recessive if it is a dominant, if it is a autosomal, isn't it? Autosomal recessive is studied, male or female parent can be carriers. But when it comes to X-linked recessive, okay, there's one thing that you have to note, that here males can never be carriers, because I told you males are what? X, Y. So even if it's a recessive trait, here the males are going to express it because they have only one X chromosome. So the male parent, whether it's dominant or recessive, the male parent will have the disease. Okay, when it comes to X-linked. Understood? Any confusion here? Just ask me if you want me to repeat. Very, very simple it is. Once again, I'll repeat it. If it's an autosomal dominant, okay, one parent will definitely will have the disease. We'll see that examples. Okay, if it's an autosomal recessive, parents can be carriers. It is not necessary that parent will have the disease. You'll see normal parent, but children will be having the disease. Okay, this is the autosomal case. Whereas if you come on to the X-linked dominant, again the parent will have the disease, no doubt. But the X-linked recessive, okay, unlike the autosomal recessive, the parent, one of the parent, that is the males, will have the disease. Females can be carriers. Okay, got it this time, hopefully. All of you, just respond. Got it or not?
Yes, sir.
Okay, so that's the first thing. That's one side you understood. Okay, that is what about the parents. Now, what about the progenies? So what about the progenies? That's what I'm going to discuss. So in the dominant, okay, whether it's autosomal or sex-linked, in dominant, there is no carrier state, and the progeny, children will never be carriers. Why? Why is it that in dominant, children will never be carriers?
As it is dominant,
Yes,
will be
there is no
expressed.
possibility of carriers. But now you'll say that, okay, so simple point. But when you come to the analysis, you will need this point. Okay, so in dominant, there is no carrier state. Why I'm saying this is you'll see, understand it later. You just see the analysis. If there is a carrier state, it's a different story. If there is no carrier state, it's a different story. So keep this in mind. In recessive, there is going to be a carrier state in the progeny. So if you see a carrier state, someone is carrying the disorder, it's a recessive disorder. Okay, if, for example, the parent is normal and there is a carrier state in the progeny, what is it? And there is no sex predilection, what is it? It's autosomal recessive, very clear, isn't it? So we'll see the examples. So 2 points you have to note here. What is parents? Parents, is at least one parent affected? Forget about the X-linked. Is one parent affected? At least it's a dominant disorder. If no parent is affected, it's a no parent is affected, or it's a carrier parent, it's a recessive. Now you'll see the progeny. If there is a carrier state in the if there is no carrier state in the progeny, it is dominant. If there is a carrier state, it's recessive. Okay, now let's come to the rules of inheritance. Okay, more understanding. So we study the rules, now we'll understand it better, in fact. Okay, so what, okay, I'll just quickly repeat it. I want you to have a clear idea here. Okay, this thing, you know. So if there is a sex predilection, if there is a sex predilection present, see if both males and females are affected. Okay, then it is an X-linked dominant. If only males, it's an X-linked recessive. Then you see if there is no sex predilection, half or 1/4. If it's half, it's autosomal dominant. If it's 1/4. Now this rule is not very strictly applied. That's why I told you, you have to see the parents also. If it is autosomal, check the parents' state. Okay, so the parents are affected, at least one parent is affected, it's a dominant, especially autosomal dominant. If none of the parents affected are carriers, it's an autosomal recessive. This much you know. Then carrier state, in dominant there is no carrier state, in recessive there is a carrier state. Okay, now X-linked dominant, how the trait is going to get transmitted. First you see this, okay, learn this, we'll analyze it, okay, as we go. So if the male is affected, we're talking about X-linked, X dominant, two things here, X-linked dominant. Now what they say is if the male is affected, which is X5, he will transmit to all the daughters and not to his sons. We'll see the example, but learn, understand this. A father will be very partial towards his daughter. You know that, isn't it? Fathers love daughters more, isn't it? So all the daughters and not to his sons. So now this, in case you can, so why disease? No, forget about the disease here. Imagine it's giving some sweets. So what fathers are doing here is to all the daughters and not to the sons. That's a little partiality. Whereas the females, you know that mothers usually though a little bit inclined towards the male child, okay, but always she gives it or shares it equally, 50% chance to both males and females. This is a case of X-linked dominant. Okay, X-linked dominant. Okay, now that is understanding it in a different way. If males is passing the disease only to daughters, males is passing the sweets only to daughters, or females are passing the sweets half and half, it's what type of inheritance? If you see the pedigree analysis, what type of inheritance it is? I'm asking you.
X-linked dominant.
X-linked dominant. Yes, you know this, but I just want your response. Now you see this. Okay, we'll see this. What does this mean? A shaded round. You tell me.
Affected female.
Affected female. So what are we expecting from here? From the above discussion? How she will pass the disease?
Half daughters and half sons. Means
Exactly. So see, this is the daughters. This is the marriage that's happened between them. Okay. There's a difference. See, this is not connected directly to parent on the other side. Isn't it? So you have to understand this. If there is a direct connection, that is the progeny. If there is no direct connection, there is no progeny. So here you will see that this is a daughter. And where is the next daughter? Yeah, this is the next daughter. And this is a son. This is a son. So it's very clear here, isn't it? That she is transmitting the disease to, out of four children here. This is the 4 children here. Okay, she is transmitting the disease to 1 male and 1 female. Isn't it? Clear. Now, this affected male of her got married to a normal female. Now, who is deceased now here? Who is deceased? Which parent is deceased here? Male or female?
father.
Father is deceased. How is he going to give the disease?
To daughters.
Yeah,
Yes.
to all his daughters. Okay, so if you see this kind of an inheritance, what will you mark? It's an X-linked dominant. No doubt.
Excellent.
Yeah. So few more things to understand, or few more clues to understand here. This will be very clear once you know this, but a little bit more. Even if it's an X-linked, we said at least one parent will be affected in dominant, isn't it? Now there is going to be a sex predilection. Okay, both males and females are affected. So we studied this. In X-linked dominant, both males and females are affected. No carrier state in the progeny. So if these 4 points are satisfied, it is X-linked dominant. Okay. Now you ask me, how do you know that there is a sex predilection or not? Is there a sex predilection here? Forget about the parent. Okay, parents, the main first generation parents. What about the sex predilection? Is there any sex predilection in the progeny?
No.
Are
No,
you
sir.
sure? Are you
Yes,
sure?
and both males and females have disease in X-linked dominant sex predilection.
No, I'm asking, is there more females? There is a disproportion between males and females here in this case.
The second generation.
Yeah, see, definitely, yes, both males and females are affected. That's dominant. But you want to check is there any sex predilection? How do you check the sex predilection? Just count the number of people affected here. Out of 3 females are affected, only 1 male is affected. So doesn't it say about a sex predilection? Forget about males, females. That is not I'm asking you. There's one sex is affected more than the other. Yes, both sexes are affected. That's why we call it as X-linked dominant. Okay.
Okay.
Got it. Both males and females are affected, but see, forget about X-linked dominant or recessive. You have to check if it's an X-linked or autosomal, isn't it? How do you check it's an X-linked or autosomal? Forget about dominant recessive. Okay, if I'm not confusing you. See, if sex predilection is present, then only we are going to this option. Both males and females are affected, or only males are affected. But how do you know that if there is a sex predilection? You have to check first that, isn't it? Is there a sex predilection or not? So you see the number of people affected, is there any disproportion? So you see there, yes, You'll understand this better, don't worry. If you count the number, 3 females are affected, only 1 male is affected, then you will say that it's a sex predilection. Okay. Instead of that, if you see 3 males and 3 females, you'll say that there is no sex predilection. So it goes to the another category, which is autosomal. Got it? So now you see here, so going back to our analysis, you go to check if there is a sex predilection or not. So you see that, you see this chart, you're getting this chart as such, okay, in your exam. And you see this chart, you're going to see if there is a sex predilection or not. That's the first step. First step is mitochondrial. So definitely this, mother is passing to children, father is also passing. Mitochondrial means only mother passes for the disease, father doesn't passes. So that is done. Next, what you have to check, is there any sex predilection or not? Isn't it? So how do you check that? Count the number of people affected, progeny affected. Then you say that, okay, 3 females and 1 male is affected. So, okay, there is sex predilection. Now, if there is sex predilection, what are the next option? Are both males and females affected or only males affected? So what is in this case? Are both males and females are affected?
Yes, both females and males are affected.
Affected, then it is going to be. So that's how you analyze. Though I have given you a direct, I've given you, say that we already got that it's an excellent dominant and we have analyzed in that way. But the question is not going to be that. The question is, they're going to give you this chart and they're going to ask you what type of disorder it is. So that's why I'm saying you have to first see if there is a mitochondrial inheritance. No. See if there is a sex predilection. Yes. If there is a sex predilection, are males and females affected? Yes. Then it's an X-linked dominant. Okay. Another details which you have to keep in mind if you want to, then there is at least one parent affected, it's dominant. Okay. No carrier state in progeny, again it's dominant. But more importantly, is it X-linked? You have to check. Okay. So do I need to show you the analysis? I'll show you, no problem. So this is male affected. How is it going to be? What if, I don't know, the lecture is going to get prolonged. It's okay, but still you'll understand it. So how it is going to be if males are affected in X-linked dominant? To whom it's going to get transmitted to?
Daughters.
Only a
All
daughter. So
daughters.
let's see how. This is the affected male. And X, I've shaded X, which is diseased. Okay. And this is normal female. 2X, which is normal. So he is now this transmission is going to be that this X and this X will combine. Okay. You will get this here. Okay. Now this X will combine to the next X. You will get this. Okay. So both are females. Both are affected because both of females are getting the, this is very important. See, deceased father's X chromosome and then the normal mothers, you get 2 females, both are affected. Okay. Now on the other side, see, the father is giving, that is where the partiality is happening. Father is giving the normal Y chromosome to the males and mother is also giving the normal X because she's already normal. That's why the partiality is coming, because father, where is the trait? The trait is in the X chromosome, but father is never giving the X chromosome to the sons. He's giving the X chromosome, the Y chromosome to the sons. Okay, so that's why the males will never be affected. Now see, who is giving the X chromosome? Who's giving the X chromosome to the sons?
Mother.
Mother. So if mother will have a disease, the sons will be affected. So that's what. So to all daughters, okay, and there is no carrier state, not sons. Okay. Now see this X chromosome, very clear now. Father is going to give this X to one progeny and this X mother is going to give. So you get both X female, okay, and then this X will combine to the normal X of mother. You get a normal female, no problem. Now the father is giving Y with this X. So now the mother is having the disease. So the male child is having the disease. Okay. So now the next thing is the Y, which is diseased, to the normal X of the mother. So this is why we said that females will transmit to half the offsprings. Okay. Father will transmit to all daughters, females to half daughters and half sons. Both affected. Now this is a different case where we'll see one like this, where the child will die. Okay, you can just calculate, just check it. Okay, fine. You can do it yourself, analysis. I'm not going to take the time for that. So here the rule is going to be what? Mother is going to transmit to both daughters and sons, father to all daughters. Okay, fine. Now let's understand the X-linked recessive. Again, there is going to be a sex predilection, isn't it? But only males are affected in the pedigree chart. Females only transmit and they act as carriers. That's a speciality of recessive. Whereas dominant, X-linked dominant, we're talking about, in X-linked dominant, we saw both males and females are affecting. So I'm repeating this many times because let it get inside you. Okay, so that's what is the difference. So there is a sex predilection in both, but the first case, both males and females affected. Here only males are affected. Females are carriers. You'll see exceptions very soon, but this is the general rule. It's a recessive disorder. So it's an X-linked recessive. So if the father is having one X chromosome, that is full shaded. Full shaded means what? Disease, isn't it? So if it was on the other side, mother, see the females here, they are carriers, only half shaded. Did you get that? It's a recessive. We're coming to recessive. So here it's,
Yes.
yeah, here the father is XY. Okay, the mother is XX, very normal. Okay, whereas if you see here, this daughter is XX, where one X is abnormal, one X is normal. But as it's a recessive disorder, it's a carrier state. Whereas you see this son is XY. So females are all carriers. There is no females having the disease. That's a speciality of this disorder. Okay, now come back to our normal analysis. Let's analyze this. So how is it going to be? Is it mitochondrial? Yes or no? No.
No.
Because here father is transmitting the disease. So it's never going to be mitochondrial. Now, is there sex predilection?
No.
Yes.
No.
Yes.
Yes, only males are affected. Okay. See females. Females are, you could see their carriers. Okay. Now, if you just consider even the carrier state as just considered as a disease, you'll see that 3 females are affected. Isn't it? Only 1 male is affected. Though male is having the disease and females are carriers. So what does it mean? There is a sex predilection. Now, if there is a sex predilection, 2 possibilities. What are they? Are both males and females? Yeah, are there both males and females affected or only males affected? So here in this case, you say only males affected. It's an X-linked recessive. This is how you analyze it. Okay, you should remember this step. You should never forget this step. That's why I'm repeating this. Now, again, we've said this, how to check if there is a sex predilection or not. Count the number of males and females. Okay, and the number of affected. If there is a significant difference between the two, there is sex predilection. 2 rules just to keep in mind: count only the progeny, not the 4th generation parent. Okay, count 2 generations excluding the parent. 2 generations, come down, not the first line only, come down also. We'll come to this. Okay, so let's understand the autosomal dominance. We understood the X-linked dominant and recessive. Okay, is males and females affected or only males are affected? Now we'll come on to autosomal dominant. This is what we said. The affected individual we have at least 1 affected parent. Now, what difference did you see? Affected individual, not male, female, like that. Okay, there is no sex predilection talking. Individual, no male effect. They're not saying like that. Individual. So affected individual will go up, isn't it? You'll have at least 1 affected parent. Okay. And as you go down, transmit the disease to half of the offsprings, irrespective of the sex. Half. Okay, this is what is called autosomal dominant. Let's see. Now, first, so half is important here. Half or more, not less than half. That's a key. Okay. So, first thing, is it mitochondrial? So, let's see, mother is transmitting to not all the progenies. If mitochondrial, the mother would have transmitted to even this, but this is normal. So, it's not mitochondrial. Is there sex predilection? Let's see, let's count. Okay. It's one male. So you have to see this connection. Okay. This is not the progeny. There is no, this connection is not there, isn't it? That connection is not there. So that's not a progeny. So that's one male, two males, three males. You can count your side also. Three males, four males, five males. We saw 1, 2, 3, 4, 5 males are affected, isn't it? Did I miss any? Hopefully not. And let's see this 1, 2, 3, 4. Did I miss any female here? No, right? Yeah, 5 females are affected. Even if it's 6 also, it's not a significant difference, unlike the previous one. See, the previous ones, out of all this progeny, only one male is affected. Very clear, isn't it? Here the ratio is, very significant, 1:3. That means if there is a 3 males affected, imagine that is into 3, that is 9 females will be affected. Of one male, 3 females are affected, isn't it? So here it's equal, isn't it? It's a kind of unequal predilection. Even you see 1 or 2 here, it's still, there is no, you should call it as no sex predilection. Okay, here we are getting very clear 5:5, isn't it? But even if it's 5:6 or 5:7 also, you should still consider it to be. Now 5:8 and all this, it's more towards the other side of the sex linked. Okay, so what do you call for this? Is there sex predilection?
No.
No.
No
No.
sex predilection. So what's the next thing to do? Very simple. Is the parent affected or not? Okay, is the parent affected or not? No. What I didn't like for this picture is, here they are showing like a carrier, isn't it? They're saying it seems like a carrier. Normally it should be like, it should not be like this. It should be a fully shaded, it should be like this. So it's very clear then one parent is affected. So normally it should be like this, but this picture is not, I will say that this picture is not very 100% perfect. But now let's come to the ratio. Is half affected or not? Because if that was the demonstration here, then it's very clear that one parent is affected means it's a dominant. We already found out that it's an autosomal because there is no sex predilection. One parent is affected, done. It's an autosomal dominant. Okay, but now it is showing like a carrier, so you can't trust that alone. That's why I'm saying you have to see the ratio also. So let's see the ratio. Okay, what did we say? Transmit disease to half of the offsprings, at least half or even more of the offsprings. So let's see offsprings irrespective of male female. So in the first generation, how much offsprings are there? 1, 2, 3, 4, 5. 5 offsprings are there, of which how many is affected? 1, 2, 3. 3 by 5, which is 0.6, which is more than 0.5. Half, more than half, isn't it? So if you just count the next one also, next generation also, 1, 2, 3, 4, irrespective of, so how many progenies as well we're counting first, isn't it? 1, 2, 3, 4, 5, of which how many are affected? 1, 2, 3, 4. So I should say 5 by 5. It's 1. Anyway, it's more, isn't it? Oh, did I miss any progeny here? No, it's fine. So it should be 5 by 5. It's 1 anyway. It's the ratio is again more than half. Again, if you come to this, okay, it's 1, 2, 3. Yes, 3 out of 4. It's 0.75. Again, is more than half. So the key here is at least one parent is affected, no sex predilection, half or more of the progeny is affected, no carrier state in the progeny. This is the rule for autosomal dominant. Now let's come on to the autosomal recessive. Forget about those possibilities and everything. It's just going to take you time. We'll discuss questions and you will see this possibilities. Okay. Now autosomal recessive, the key factor here is parent is unaffected, can be carriers. Okay, mostly parents are carriers. Okay. Then affected individual without any sex predilection transmit the disease for less than half of the offspring. Mostly, again, there's exceptions here, but mostly less than half, usually 1/4. Okay, usually 1/4 of the offspring. So let's see this. Now this representation is much better, isn't it? So it's not mitochondrial directly. Then what you're going to see, sex predilection is there or not. So that's what I'm going to count. Okay, I'm going to take a little bit time. But yes, you have to understand this. Is there sex predilection? So yes, 2 females, 1 male as affected. Okay, so you can't call it as a huge proportion. Instead of it was 3 females and 1 male, then you can call it as a sex predilection. 1:2 is and all is to be considered as non-sex predilection. Okay, now let's see the carrier state. It's 1, 2, 3, 4, 5 female carriers, isn't it? Correct me if I'm anywhere here I'm missing. 1, 2, 3 male carriers. So again, there is no significance. Okay, there is no huge, that is 1:3 ratio is not there. It is the 1:2 kind of ratio. Okay, so it's no sex predilection. If there is no sex predilection, see if parent is affected or not. Here it's very, very clear. Both the parents are carriers. Okay, that half shading. That's why I told you the previous one that half shading is on. So the parents are not affected, are carriers, clearly gives you the answer that is it's an autosomal recessive. Okay, it's a recessive trait. Now coming further, see if how much is there half offsprings affected here? No, there is. If you have 1, 2, 3, 4. 1/4, isn't it? 1 out of 4 is affected. If you just consider these progenies, 1, 2, 3, 4, 1 is affected. 1 out of 4. Rest are carriers. Now, another rule for recessive is what? What is the rule for progeny in recessive?
Carrier progeny.
Sorry?
Carrier and progeny.
Yes, carriers will be there. So that's very clear again. There is a carriers and progeny. Okay, so let's see that. Not necessarily one parent to be affected, it can be carriers. There is no sex predilection, less than half, usually 1/4 is affected, carrier state in progeny. Got it? Mitochondrial inheritance, I'll just finish this off. It's very simple. Affected male will be non-transmitting disease to any offsprings. Affected female will transmit all the disease to the offspring because mitochondria comes from, the mitochondria is there in ovum. Okay, so if you just take this, here mother is affected, so she will give it to all progenies. Okay, this is the marriage on the sides. Okay, mother is affected, giving to all progenies. Now here the father is affected, no progeny is affected. Okay, if father is affected, no one is affected. Mother is affected, all are affected. That's mitochondria. Okay, now let's, okay, I went to the answer. Anyway, the question is, male is hemophilic, his wife is normal, which is true. Now here, you have to understand which are the autosomal dominant disorders, which are the autosomal recessive disorders. Okay, examples. We have taken lectures on that. We've given you short forms on that. So for those it's not taken, if it's not covered yet, we'll cover them soon. Don't worry. But understand this analysis part. That's the key. Okay. So you have to know which is autosomal disease or recessive disorder, which is X-linked recessive, which is X-linked dominant and all. Examples. Now, hemophilia is an X-linked, which one? Dominant or recessive?
Dominant.
Recessive.
Recessive. Hemophilia and X-linked recessive. The answer is okay. All daughters are carriers. We'll understand this one by one. Is the sons affected? That's the first statement. We'll see that with the statement 1 is wrong. Why? We will see. What did they say? They say father is affected, mother is a normal, isn't it? In hemophilia. Male hemophilic is the question. So male is hemophilic, wife is normal. So this is the case. Male is hemophilic, wife is normal. So now see, this X will combine with this X. You get this, which is a female. Okay, this X will combine with the next X. You get this again, a female. So two females which are carriers, recessive, isn't it? Recessive we are talking about. Hemophilia is a recessive disorder. So if only one X in females, both of them are only carriers. So the statement, all daughters are carriers, are true. That's what the correct answer for this is. Okay. Now, let's see the next possibility where Y chromosome combines with the XY. Okay. Now the next Y chromosome combines with the next X. You get again XY. Okay. Where males are not affected. That's recessive. So recessive, we said, what did we say about recessive? X-linked recessive. What was the rule for X-linked recessive? What was the rule for X-linked dominant? You need revision for this. Okay. What was the rule for X-linked dominant? I'll repeat it for you. X-linked dominant, the rule was both males and females are affected. X-linked recessive, only males are affected. Doesn't mean that every time males will be affected. No, it is not necessary. If there is a disease in X-linked recessive, it will be only by males. Males can be normal, but if there is a disease in a progeny, that will be only males. And females will be normally carriers. Okay. Got it. So here males are not affected because the Y chromosome again is coming from father. We saw the same issue in the X-linked dominant also, isn't it? But their X-linked dominant, the females are, father is passing the disease to daughters because X-linked dominant. So the inheritance pattern is the same. But only thing is one is dominant and other is recessive. So in dominant, even one gene it is expressing, other is not expressing. Okay. Now, what's the next option? 50% of his daughters are carriers. No. All his daughters are carriers. Okay. 50% of sons are carriers. No. None of his sons are carriers or affected. Got it? So in this case, you have to just write it down. Okay, this is where the pattern slightly changes. Okay, saying male is hemophilic, his wife is normal. You have to write this and analyze it. Okay, don't purely rely on your rule. Okay, male is hemophilic, his wife is normal, autosomal recessive. You can put yourself in trouble by saying that, okay, male is autosomal recessive. So you say that, okay, sons are affected. Yes, correct. Because in in X-linked recessive, am I saying autosomal? In X-linked recessive, we'll say, okay, only males are affected. So this is correct. No, you just write it down and see, you'll get the other thing. Okay. Okay. So usually in X-linked recessive, the rule is like this. If someone has the disease, that is going to be males. That is, only males are affected, females are carriers. It doesn't mean that always males are affected. So hope you understand the difference between the two statements. Always males are affected is a different statement. Only males are affected is a different statement. Only males means what? If the disease is affecting someone, that is only males. Females are carriers mostly. Okay, repeat this, take down the notes. Okay, and repeat this. I'll give you the notes. Okay, don't worry. I'll give you the notes and repeat this. If possible, write it down. That's better. The recordings will be there. Watch it and write it down. Okay, let's go for this also, isn't it? Are you tired and bored, or are you getting confused? Did anyone
Mm.
excel? No,
No,
12
sir.
people.
Oh, no, sir.
Understanding,
Yes,
no?
sir.
All of you.
Yes, sir.
Yes, sir.
Little confusing as you go deeper and deeper. That's called entrance preparation. That's why I tell you all to first initially stay peripheral. Don't go into too much of depth. See, when we saw the first two charts, it was so simple, isn't it? Then as we went on into depth, it became complicated. Now, the first part, that's what typical example. The first two parts, first two charts, that is the initial reading. The remaining comes with revision. Okay, the remaining which was confusing, if you start thinking that, okay, I've confused and it's not going into my mind, I forgot it, and I'm going to stop my preparation, then you're going in a wrong way, because your first understanding will be only the peripheral part, the simple part. Have you understood the simple part here? You have done the first time lecture. You have done the first time thing. Okay. Remaining, you're understanding, but you might forget it. You're understanding now, isn't it? But to retain it, you have to revise it. That's why I tell you, revise it next day morning, revise it on Sundays. Okay, keep revising it continuously. Then only these confusing areas will go in. Okay, so now let's come to the next question. Now, a general question to you all, quickly type it down as personal message or a public message in the chat. Okay, how many hours do you prepare in a day? Okay, so 4 to 5, 3 to 4, 3 to 4. Now see, we're going to the next phase of our preparation. What is that? Last 6 months of a preparation, isn't it? It's May already, so June, July, August, September, October, November, and December. December probably could be an exam. Okay, there's high possibility in December, January. So, is there anyone expecting that it'll? Is there the general understanding? Let me just know. Okay, I want to know from you all. Is that people are saying you in your colleges, in your friend circle, that exam will be in March? That is a rule kind of thing? Or what is the general expected date in your colleges, in your friend circle, the talk? What is it? You can type it or put it there. Yeah, everyone in December. What about others? Others, just what's the talk in December? Okay, two, three more. Jan. January, yes, December, January is what is expected. Now, so we are getting into the next phase of our preparation where what you're going to see, you're going to increase your time. 4, 5 hours time is over. 3, 4, no. Okay. To be very frank with you, I don't want you to miss your 1 year and miss your or regret after this year. So for that, I'm saying it very frankly. Those who are preparing for 3 to 4 hours in the coming 6 months is just wasting your time. Just wasting your time. Okay, if you want a seat, if you're thinking that, okay, I'll try this time, next year I'll prepare seriously, then it's okay. But 3 to 4 hours, no. Okay, 6 to 7 hours, expect a good. 4 to 5 again, you have to increase. You're doing good job. So even 3 to 4 people, get it to 5 plus initially. And as soon as possible, get into that 8. Okay, 8 mark. As soon as possible in the next 3 months, get that 8. Okay, 6 to 7 is very good. Okay, 7 to 8, very good. Melissa Thomas, very good. So that is what is normally expected in the coming months. Next 6 months, it should be at least 6 to 8 hours. 4 to 5, 9 to 10, very good. Kamal Priya, very good. 3 hours, Mahavesh Fatima, no. No, if you're now, even if now some people, Nuzila 3, I think I've just started, so it's okay, 3 to 4, no. Asta single, no. You're very active, you're very, but 3 to 4 is not enough. Shankari 3, no, not at all. If okay, so it's not that 3 to 4 or even now 5 is not what is normal. Now the coming days, 5 plus. In the next 6 months, it should reach 8. In the last 6 months, 10. And then it's going to be easy for you. So it's very important. I'll ask you keep on asking you the same question in the coming days as well. So 5 plus is minimum now. 5 plus, more than 5. Anything less than 5, not acceptable. Okay, 5 plus, that is around 6 plus, 6, 6, 7 to 8. Okay, and the person who's doing 9 to 10, be a little careful that you are not saturated. Okay, you are not getting saturated, just relax a little bit. Okay, so now why am I saying this a little bluntly, that you're wasting your time and all? See, it's basically, I want to see you all clear the NEET. Okay, if you don't clear, if you're learning, there's an effective learning period for how much portions to have got over and how much to finish and all. So that is usually in this phase, it is 5 plus. Initially, if you would have said me when you started in February, in January, March even, okay, you say me 3 hours, 4 hours, I'll say fine. But now it's 5 plus. Okay, so will you all try to get it more? Somehow get purchase it from somewhere. Decrease your no leisure period. There is no. Let me tell you, in the last 6 months, I never thought of anything more than 10-15 minutes after every hour. Okay, where I would relax. Hope you got the sentence. I framed the sentence in a wrong way. That is, in my last 6 months, almost not every day, in between maybe I would get some, maybe some very important functions, very important functions, not relatives marriage or not friends marriage or like that. No, there is a cream layer, isn't it? 250, 300. How do they get this? Lots of sacrifices. It doesn't happen all of a sudden. You don't get into a government dental college all of a sudden. It's lots of sacrifices. You close your eyes many a times for lots of functions. You even cry. Okay, literally, you wish you were with your partner, but I was out of my house. Like I stayed in a distant location from my house, and my wife was staying in my house or her house, like, and I always wanted to be with her, and it was newly married. Okay, newly married couple situation, and so that was sacrifice, and after sacrifices only you get into these kind of situations. So you have to purchase the time now from something which is lesser important for your need, maybe more important for your personal life, but literally, let me tell you, if you're an average student like me, you have to compromise. Okay, you have to compromise a lot and get into. So let's come back. So hopefully I'll ask you next time, did you if you're saying me that, sir, no, I have this problem, I have that problem, no. We literally fight with people. Not that the WWE fight, but we had to be silent for many things. We have to be unreactive to many things. Maybe someone will blame you for what you're doing, what you're studying, they will have hundreds of reasons to stab you on your heart. They will, lots of things. You have to just keep quiet. Okay, and say that no, I'll answer them all with my success. Okay, and they will accept it then, and they will trust me. So okay, let's come to this. An affected male infant born to normal parent could be an example of all of the following except. An affected male infant born to normal parents could be example of all of the following except. So normal parent could never be. So what's one thing? In autosomal dominant, it could never be normal parent. That's what the key is. Okay, got it? It can be autosomal recessive, isn't it? We'll see the other two as well. Got it? Let me just clear it once again. An affected male infant born to normal parent could be example of all except. So normal parent could never be an autosomal dominant, or I would say it could never be dominant, especially autosomal dominant, because in dominant one parent will be affected. Okay, even in X-linked dominant also, but more commonly autosomal dominant. Okay, so the correct answer is, so in polygenic also there can be a normal parent, vertically transmitted disorder also there can be a normal parent. We'll see what. Okay, the first you understood. The second again, polygenic disorder. What is that? Polygenic disorder is one option. So it's also known as multifactorial. So it's understandable, multifactorial, multiple factors involved. Okay, that is, it's a cumulative effect of multiple genes. Many genes combined together produces the effect. Normally, autosomal dominant, recessive and all, it's usually one gene being affected. But polygenic means multiple genes being affected, plus the influence of the environment. So two things are important here. Cumulative effect of multiple genes plus environmental influence. Okay, now example is type 2 diabetes, where you have these three genes, multifactorial, multiple genes. Okay, if you want to learn it. Okay, I've just taken it from internet as an example. It's not there in your textbook. TCF7L2, then PPARG and KCNJ11 genes. Okay, it's not important. Plus predisposing factors for diabetes. What are they? High sugar diet, obesity, this. So that is environmental. So that's called a polygenic disorder. Now you know that there can be a possibility that the parents of an affected individual can be normal. Why? There is a possibility this first gene is being given by father, second gene by mother, third gene by again father. Okay, so and the child is getting all the three, but father is having only two, mother is having only one. So there is a possibility that what? The parents are normal. And also what is also important here, there is also something known as predisposing factor. So imagine father and mother doesn't have high sugar diet, so they don't get diabetes. So there's a high possibility that the parent of an affected individual can be a normal. Got it? Polygenic. Why polygenic? The parent can be normal. The question is that, isn't it? Question is normal parent except. So this can be a normal parent, polygenic. Now vertically transmitted, again there's a possibility that the parent is normal. Why? Now there's a bacteria called GBS, that is group B streptococcus. Okay, group B, we've studied in microbiology, isn't it? Group B streptococci. And many of the group B streptococci live as a symbiotic organism in the vagina of mother. Okay, and where it's symbiotic in mother's vagina, it's normal, no problem. It doesn't cause any disease. But during delivery, what happens is occasionally it can cause infection in newborns like pneumonia, sepsis, meningitis, and all, which is possible, especially meningitis. Okay, so what they do is they do prevention by screening for these organisms, and if there is this organism found, then antibiotics are given. But the key here is mother can be normal, child can be affected in this case also. So all the three cases, autosomal recessive, polygenic disorder, vertically transmitted disorder, all the three, it can be a normal parent with an affected child. But in case of autosomal dominant, always father or mother will be affected. At least one will be affected. Shall we go to the next question? In a family, father has a widely spaced eyes. So it's father. Okay. Increased facial hair, deafness. One of the three children has deafness with similar facial features. Now, one of the three children, what does it mean? One of the three children. Is it sex linked? No. I'm asking, is it sex linked or not? No, one of the three children. They are not mentioning male, female, anything like that. So it's definitely autosomal. Yeah, it's definitely autosomal with similar features. One father having the disease, and one of the three children have a difference with similar features. Mother is normal. Which of the following is most likely? So it's very, very clear. Two things. What are they? It is autosomal. One parent is affected means what? At least one parent is affected. At least one parent is affected in autosomal. Dominant. So that's the answer. Simple. Isn't it? So understood. I don't need to explain this. If you just want to write it and check it, you can do it. You know it now. But it's very clear. Let's go to the next. Father transmit the disease to all the daughters. This type of inheritance is what?
X-linked dominant.
Yes.
X-linked
All daughters.
recessive.
No.
Rec-
In
X-linked
recessive,
dominant.
the disease is not transmitted, only the carrier state is transmitted.
yes.
Okay. Though the father is transmitting it to daughters itself, but it's not the disease which is transmitted, it's a gene, but the daughters are carriers. So the disease is transmitted only in what? The dominant.
Dominant.
Okay. So the answer is very clear, X-linked dominant. Okay. So answer is done. Now, yes, I'll give you this chart and I'll ask you what disease it is. 4 options: sickle cell anemia, hemophilia, red blue color blindness, hereditary spherocytosis. Anyone can answer it. Applying all the start. Is it mitochondrial? Is it sex-linked? If it's sex-linked, it is how. If it is not sex-linked, it is how. And then out of this, you have to select that disorder. A little complicated question.
Autosomal dominant.
And give me the answer. What's the answer?
Hereditary.
Sir, D.
Yes,
Hereditary
I think I have
spherocytosis.
not analyzed. Let's see. Okay. So what disorder it is? First thing is what? Is it mitochondrial? No. Is it sex-linked? Answer is no. Why? Because it's a kind of equal predilection.
Yeah.
Both males, females, equal. So there is no sex predilection. So if there is no sex, I'm sorry, if there is no sex predilection, it is autosomal. If it's autosomal, very simple, go to the parent. Is the parent affected?
Yes.
Yes, it's autosomal dominant mostly, but don't be so sure. Check with the progeny also. So it's like 1/4, 2/4, half. That is more than 0.5, isn't it? So here we have not mentioned all the progenies, so that's why you can't count this area. Okay, here we have mentioned all the progenies, so it's much more easy to count it here. So it's not 1/4, it is more than 1/4 or even 0.5 or more. So it's definitely 0.5. So it's autosomal dominant, but easier ways to check the parent. One parent is affected, it's autosomal dominant of this hereditary spherocytosis is autosomal dominant. Okay, so this is basically the chart. So option A, B, C are autosomal recessive. D is autosomal dominant. So you have to learn the example. So all the 3 are, no, hemophilia is X-linked recessive. So that's wrong there. A and C are autosomal recessive. B is X-linked recessive. D is autosomal dominant, isn't it? So you have to know the example. So it's a little difficult question. Now, what type of inheritance is this? Now you tell me. Someone. Same order, mitochondrial, yes or no? Is there sex predilection, yes or no? Very easy, very clear here. One shot should answer the question.
Autosomal recessive.
No. Is there sex
X-linked
predilection?
recessive.
Yeah. Sex predilection is very clear here. Only males are affected.
Yeah. Okay.
Okay. So that's the order should not change. Yeah, you see the parent is normal, you say it's recessive, then don't go for autosomal recessive. The order should be, is there sex predilection or not? Okay. So if there is no sex predilection, then you go for autosomal. If there is sex predilection, so you change the order, you can go wrong. Only males are affected in which?
X-linked recessive.
X-linked recessive. Now, so that's it. Now, okay, a very long question, very simple. This is what you get in AIMS. Okay, very simple question it will be, but it will give you so much of length. So what is usually advised? Don't read this question in the first round. Come back in the end. Okay. And this is where now one more thing I want to tell you. See the options. When you see very big questions, just check the options. From here, what is the analysis? What tells you? What should you look into? Because the examiner or in the question paper, they are not going to tell you that this question is from genetics of general pathology. No. So what are you going to look here when you see this option? Tell me, someone. What should come to your mind? The question is on genetics. So you have to check that two charts should come into my mind. That's where systematic learning is going to help you. The first two charts we studied, right? Is it sex-linked or not? If it's not sex-linked, so that if you see this, that chart should come into your mind. And from that chart, you're going to analyze this question. That's how. Okay. Now, if you have something else, if it is about necrosis, if here you see that, okay, here in the option, you see the coagulative necrosis, that necrosis, this necrosis, liquefactive necrosis, fat necrosis, then another area should come into your mind. Okay, so that's how you see the options also before getting into the question. Quick review of options. Now I will see how. Okay, so the question is, now you know that it's genetics. So kinky hair disease is a disorder where, read it quickly, where affected child has peculiar white stubby hair. It's not significant at all. It's just going to waste your time. Okay, does not grow, brain degeneration is seen and dies by age of 2 years. Now this is where more significant thing is going to come. Mrs. A is hesitant to having children because her two sisters had sons. So sisters are normal. They are not had sons who had died from kinky hair disease. So here sons are affected. One. Okay. Mrs. A's sister's sons. Okay. And her mother's brother also died. Her mother's brother also died. That's again male. The same condition, the possible mode of inheritance is what? One thing, first thing, is there sex predilection?
Yes, sir.
Yes,
Yes.
males. And only males. Only males.
Yes, sir.
X-linked recessive. So easy. That's what I was saying you. Everything else becomes insignificant. Okay. When you see this options. Okay, this is where tricks come into play. This is where practice of questions comes into play. This is where your revision comes into play. The moment you see this, that chart should come to your mind. That will come only with multiple revisions. Okay, that's my purpose of this live sessions, to give you this kind of understandings, that how to solve certain questions. It's not every time, what happens if you're reading these questions for the first time in the exam and in the first round itself. You will start reading. I'll give you an example here. It's a disorder where an affected child has peculiar white stubby hair, does not grow, brain degeneration is seen. You say, oh my God, this question I don't know. Okay, you stop there. Because you have never heard of something like white stubby hair, doesn't grow, brain degeneration. You say, I don't know. But if you know this is what is expected from you, and you have to analyze the question in that direction, okay, how do you see? The chart comes into mind. Is there sex predilection is the first thing. So you see, is there a sex predilection they're talking about? Yes, they're talking about it, sex predilection. So that's how, reverse or retrograde analysis I tell in the orientation sessions. Isn't it? Retrograde analysis, systematic learning, revision, everything comes into play. We'll understand this more and more as we go on. Okay. Now, an albino girl gets albino girl, so it's girl, gets married to a normal boy. What are the chances of their affecting the child? Okay, having an affected child, and what are the chances their children being carriers? So they're asking, like, albino girl with normal boy, how much will be carriers? How much will be affected? Okay, so here you have to know albinism is what type of disorder. It's an autosomal recessive disorder. Okay, autosomal recessive. It expresses only when both the genes are problematic or in homozygous state. So what they're talking is normal male homozygous recessive female. Okay, both the genes are affected. That's why I said you that you should know that albinism is an autosomal recessive disorder. So now let's pair the genes. So this with this, you get this. Okay, and you compare this with this, again you get the same combination. You pair this with this, you get the same combination. You pair this with this, also same combination. It means what? All the four are carriers. Why? Because it's an autosomal recessive. That's where I told you examples, you should know. It's an autosomal recessive, then all the four are carriers. Imagine, just for your understanding sake, that albinism is an autosomal dominant disorder. What will be the condition then? Who's going to answer? If
Same answer.
same pattern. Father is normal, female is affected. Okay, female is affected. Then what is going to be the combination here? The complete scenario will change, won't it? It's A. So this one is the dominant situation. Okay, so if then let's see. So let's see the combination now. A. Okay, then you have got the next A, that is A with sorry. The first A will be two blues, isn't it? This with this, two blues. Okay, next you have got this with this. So that's the next one. Then you have got the first A with the normal A again, then capital A with the small a affected. Okay, so here this will be affected, this will be affected. That is 50% affected, 50% normal. If you get a disorder which was autosomal dominant, but now in this case we have got autosomal recessive albinism. So this is the calculation. All of them are carriers. So the question was, what are the chances of the children being carriers and what are the chances of the affected child? So the answer is what? All carriers, I'm sorry.
A.
All carriers, none affected, isn't it? All carriers, none affected. 50% carriers is if it was an autosomal dominant disorder. But albinism is autosomal recessive, so you get all carriers, none affected. Understood? Did you all
Yes.
understand?
Yes, sir.
It's very, very simple. I'll just quickly, not the entire part, just that two charts. I'll explain to you and then we will stop. So two things here. See if there is mitochondrial inheritance. Another shade. Okay. Then if there is sex predilection, that's the next step. Sex predilection. If there is sex predilection, if both males and females are affected, it's X-linked dominant. If only males are affected, it's X-linked recessive. If there is no sex predilection, see if there is half or 1/4. Plus, in autosomal dominant, at least one parent will be affected. In autosomal recessive, none of the parent will be affected, or both can be carriers, or one can be carrier, like that. Okay, but it's not necessary that if a parent will be affected. Okay, next thing is in dominant, especially autosomal dominant, like the same thing, one parent will be affected and there is no carrier state. In recessive, especially autosomal recessive, the parents can be carriers, or it can be none will be affected and there will be a carrier state. Okay, rest, then again, this also I'll just quickly rush through. X-linked dominant, father to all daughters, mother 50%. Okay, whereas X-linked recessive, only males are affected, that's the rule. Okay, females are being given to their carriers. And rest, okay, it's the same thing. So shall we conclude? Did you understand how to analyze? Was this a difficult topic when you learned it or when you were solving the questions? Yeah, you have to revise it, then only it will go in. Okay, I'll put the notes tomorrow in the morning. Okay, the same notes I'll put it in your app and you can download and read it and go through it once again. try to write it once, at least that first two charts, then it will be very easy. So that's it. I'll stop this session here. See you in the next class. Goodbye.